Hello there, it's Judith and Desjardins at UCLA Hospital, and things are definitely looking up right now. I get to wash my face just like I do at home with this great clairsonic brush that massages the face and the lymph nodes. And removes all the trauma of the surgery yesterday and makes me feel like a real person again. Just a few drops of water makes all the difference in the world when you're feeling yucky in a hospital room, in a hospital bed. My nursing helper, James, was very sweet to me and got me into this firm back chair, which is ever so much more comfortable than the nice pillowy mattress that doesn't support my lumbar and my back. And I've been trapped in the bed with all these monitor strings all night long, and my back was just so painful. So it's really nice to be in a firm back chair like a real person and get to do my morning toiletries. I brought my electric toothbrush as well, which is going to be really fun because I have this terrible taste from the surgery and I haven't been able to drink any water, and this is going to make me feel really clean. Feeling clean and human is so important in a hospital where you feel sort of inhuman surrounded by these machines. So to have clean teeth be able to rinse your mouth goes a long way to feeling happier. Sorry about the day. Boy, does that feel good. Nice taste to the UCLA toothpaste as well, I must say. And then what else do I have in here? I thought he gave me my little Ziploc with my brush in it. Oh, I get to actually comb my hair, which is also going to feel great. This is the little collapsible comb that I took on my trip to Japan because it didn't take up as much room as my brush at home. It was a good travel companion, and that too feels great. Everybody likes to be able to do these things on their own for themselves as part of their morning routine, feeling more human and more like the individual they were before the surgery. So, and it's nice to just run a brush comb through your hair and get that stimulation for your scalp after you had a surgical cap on yesterday and were in a 4-hour surgery and didn't know what the heck was going on. This feels lovely, and I'm very happy to have that in my little bag of goodies here. All of these beauty products remind me of home and the person that I am. Here's another great moisturizer for my skin, which is going to feel nice having been in the hospital and all the air is circulating and drying you out. So this feels really great to be adding moisturizer. Because yesterday there was all this kind of caked on something on my face. I don't know where it came from, but it wasn't a good thing. And now at least I have moisture in my face. It's very interesting in terms of the resilience of my body, because even though I was sick and I didn't know it, there was this invisible to me pancreatic cancer, a little 1.7 by 1.4 centimeter size cancer growing in my pancreas, and it is the reason why I had the abdominal bloating and the wasting of my arm muscle and leg muscles. There is a duct inside the pancreas that releases the flow of digestive enzymes and insulin into the small intestine. It's a very important job that the pancreas does. And this little piece of cancer was blocking the duct so that I didn't get enzymes that could digest my food. I was passing food through my intestinal tract, but it wasn't nourishing me because it didn't have the enzymes that broke it down so the body could absorb it. And my blood sugar level was slowly rising because the pancreas was not able to deliver insulin into my bloodstream. So it's very important that I had that surgery yesterday to remove the cancer. The doctor said it was a bit of a miracle that my cancer was detected through a CT scan and a ultrasound, an endoscopy with ultrasound, which the CT scan said there was some vague dense thing in my pancreas right by the duct, and the endoscopy, where they put a tube down your throat and they go down the esophagus into the stomach, where they can check out how the stomach is doing, and they can actually look through the wall of the stomach and see that there was this 1 by 7 by 1 by 4 centimeter little cancer in there, which told me that I was a very lucky girl because it was caught extremely early was removable, and also they removed the cancer. There was a non-threatening cyst in there, but there was also the tail of the pancreas. The pancreas goes up like this and comes down into the body. The tail of the pancreas had been dying because the cancer was blocking the flow up toward it as well. So they removed that atrophied part of the pancreas, probably 30 to 40% of my pancreas, the tumor, the cyst, and then they had to remove the spleen as well because there was a shared blood flow between the spleen and the pancreas. So as a precautionary measure, they take out the spleen. The spleen's job, it's called the ancillary can't think of the other term now. It's an ancillary organ which helps the immune system. It's an ancillary immune system organ that fights off 3 different kinds of bacteria that might invade the body. So they remove that all in one piece. They send the whole deal, all that material, to the pathologist, who then slices through looking for any hidden pieces of cancer anywhere. And that would determine whether I need to have chemotherapy or not, but the doctor thinks I won't. And he takes what they call wide margins, like extra tissue around that problem area to make sure that none of the cancer has been left in that area where he's cutting. So I am one blessed, lucky girl that it was detected early, that I had surgery yesterday by a nationally renowned surgeon, Dr. Timothy Donahue at UCLA, and that I'm in this hospital which is keeping me safe during coronavirus and monitoring me very closely while I'm on pain medication and my body is slowly healing. So this is one very happy Judith and Desjardins from UCLA Hospital. Thank you.